Madam Clerk.
Oral questions by members.
Leader of the Official Opposition.
Thank you, Mr. Speaker. Sydney was an 18-year-old general science student at the University of Victoria, like all 18-year-olds, full of life and promise for the future. Tragically, her bright future was ended by a preventable overdose. And today, her devastated parents are fighting for accountability and changes so other families will not have to endure this agony. In a letter to the Premier, her parents write, and I quote, "Our daughter's death was completely preventable. Systemic failures by both the province of BC and the University of Victoria led directly to Sydney's untimely death." End of quote. So my question to the Premier, how many more young lives will be lost before this government recognizes that his government's approach to this drug crisis is tragically failing and that dramatic changes are necessary and urgently needed to protect our youth?
Premier.
Thank you, Honourable Chair. This is an absolutely horrific situation for Sydney's family, for her friends. The timeline of events is profoundly disturbing, reconstructed by Sydney's family. And they have the 911 call, which they've listened to, which I can't even imagine what that would be like as a parent. I've had a very brief conversation with Sydney's mom, who has been advocating for her daughter, that her daughter's death is not in vain, that it results in reform, and that what their family is going through is not repeated. The Solicitor General will be directing a coroner's inquest, and the point of the coroner's inquest will be to get the answers for Sydney's family, absolutely. To get answers for British Columbians, and to get answers for this place, to make sure that we're doing all we can to prevent every death that we can in this terrible toxic drug crisis that has taken so many lives and damaged so many families. We've stood a number of times here and explained our twin goals: to keep people alive, to make sure that they're able to survive, and to support them in recovery while ensuring safe communities. Sydney's death is horrible, and it is a death that is preceded by thousands of other deaths and affected families and friends. This toxic drug crisis is a public health crisis. It is a tragedy, and it's hard to think of a case that better illustrates that tragedy than the death of such a remarkable young person as Sydney.
Leader of the Official Opposition, supplemental.
Thank you, Mr. Speaker. As the parent of two daughters myself, I know that I speak for all parents that are concerned that more words are not going to be enough. What are needed are changes so that we get different results. I've been talking about this with this Premier ever since I've been in the legislature. We are 8 years into what has been called a public health emergency. It was designated as one in 2016, and the response under this Premier can best be described as patchwork, half measures, and fatal inconsistencies. Some campuses have accessible naloxone, while others restrict access to business hours, a life-saving measure that is impeded by bureaucracy. In their letter to the Premier, Sydney's parents demand mandatory CPR and naloxone training, free and widely available nasal naloxone, improved emergency protocols on campus, and yes, a coroner's inquest, which I'm pleased to see that the Premier, I believe, has committed to at least making sure that that happens. But to the Premier, will the Premier listen to this grieving family and follow through not just on their recommendations, but the call from this opposition, as we've been calling for years, that the solution to this drug crisis also has to include education, education for our young people so they understand that all drugs are dangerous and drugs can be fatal. Will the Premier at least commit to doing that and protect the next group of young people from not having to go through what Sydney and her family have had to deal with?
Premier.
Thank you, Honourable Speaker. The part of the tragedy of Sydney's death, as I understand it, is that there were security from UVic that were in the room as she died that had naloxone, training, and did not deploy that naloxone immediately. There are serious questions that need to be answered about this horrific death, which is why the Solicitor General has directed a coroner's inquest. We are reaching out to university presidents right across the province to make sure that they are doing all they can on their campuses. We have naloxone available for every post-secondary institution. And this is the situation that anyone can imagine. There's a kid in a dorm room with a friend that they trust and like, that offers them something and they don't know where it came from, and it ends up in a horrific result that could have been prevented. This is horrific. And we will work with the family to get them the answers that they deserve. And we will ensure that any necessary policy changes are in place to prevent similar deaths.
Member for Prince George Valemount.
Well, thank you very much. And part of the action that is required is to actually remind young British Columbians that there are no safe drugs. The Premier completely avoided committing to talking about that in British Columbia. But my question is to the Minister of Post-Secondary Education. Straight question. Does her ministry oversee and regulate the training of first responders on post-secondary campuses to ensure that they are equipped to handle medical emergencies involving students?
Minister of Mental Health and Addictions.
Thank you very much, Honourable Speaker, and thank you to the member for the question. And of course, in this House, we are all grieving with Sydney's family today as a result of her tragic death. I want to assure the member and all members of this House and everyone in our communities that we are working across all of our post-secondary system, across our health authorities and public health to ensure that we have the appropriate procedures and training in place to ensure that this doesn't happen again, including our education campaign, which is very much exactly that, telling youth that the illicit drug supply is poison. It is contaminated. We've been running that campaign last fall. It's running right now.
Member.
It's going to be.
Member for Surrey South, control yourself, please. Minister will continue.
This is work that we do across the education system to talk to youth about the dangers of the illicit drug supply right now, and we will continue to do that work, Honourable Speaker.
Prince George Valemount supplemental.
I am sure those words bring little comfort to Sydney's parents and people across British Columbia who are grieving every day. All we hear from this minister is words. Yesterday, the Minister of Post-Secondary Education ran for cover when she had an opportunity to answer these questions. The Minister of Post-Secondary Education declined yesterday to speak with Post Media about how her ministry is safeguarding over 300,000 post-secondary students from overdose crisis. She has not addressed, even today, why naloxone is available and easily accessible in emergency boxes on some campuses, while others restrict access to business hours only. That is her job. That is her responsibility. She should have stood up yesterday and said, I'm taking care of this. I will ensure that this is mandated for every single post-secondary institution. She refused to answer the question, will she do it for Sydney's parents today?
Here, here.
Minister of Post-Secondary Education.
Thank you, Speaker. And I want to echo the Premier's sentiments and pass my condolences. And my heart goes out to Sydney's family and to her brother and her friends. This is a tragic incident. We are taking action. I am meeting with the presidents of the post-secondaries to review the policies that are in place so that we can ensure that
Member.
so that we can make improvements and ensure that students are kept safe. Naloxone was in the room, Speaker, and unfortunately it was not used in a timely manner, according to what we've heard. There is a review underway with BC Emergency Health Services. The Minister of Public Safety has directed a coroner's inquest to get more answers. We are taking action to make sure that we get answers for Sydney's family and so that we can protect students on our campuses all across this province.